Are you going to have ACL reconstruction surgery? If so, you got to listen to this because we're going to talk about the different types of grafts you can choose for your surgery, especially if you're going to use your own tissue. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors. So let's jump into it, guys. So if you're planning to have ACL reconstruction surgery, you're planning to have some kind of graft to replace the ACL ligament. The reason we say that is because the ACL ligament, most of the time, will be reconstructed. It won't be repaired. Some of the times it will be repaired, but it has to be the perfect tear, it needs to be the perfect age, and there's a lot of other factors. So it's very rare for that to happen. So most of the time they do reconstruction. When they have the reconstruction surgery, there's two main types of grafts you could choose from. The autograft, which is from your own body, or the allograft from a cadaver. For this segment, we're just going to be talking about autografts, using your own tissue. And we're going to break down the three main types, which are the patellar tendon, quad tendon, and the hamstring. And we're going to go over the pros and cons of each and see which one would benefit you the most. All right, guys, so before we kind of go into those three grafts, I just want to re-emphasize the reason we're talking about autografts is because a lot of the times when you're at a certain age and a highly competitive level, you're going to choose autografts. But we're going to have a different video talking about why you should choose an autograft versus an allograft. But for right now, we just want to explain, if you decide to choose your own tissue, an autograft, the three different grafts. So the first one is the patellar tendon. So the patellar tendon has been widely considered the gold standard. The reason it's been the gold standard is because it's been researched the most, used the longest as well, and it has one of the lowest re-tear rates. So when it comes to the the patellar tendon, is because it has a bony insertion and origin. So what happens is this graft has bony ends. With these bony ends, it allows the ligament or this graft to become a ligament a little easier. So the studies have shown that whenever we try to reconstruct the ligament, so we replace it, there's a period called the ligamentization, where this new ligament will turn into a ligament. When you have bony ends, it helps accelerate that process so that patellar tendon will become that ACL ligament a little faster than its counterparts. Those are some of the main pros. The cons, though, there are some issues with the patellar tendon graft. One is there's a risk for a patella fracture. So because they get a piece of the bone of the patella, you may increase your risk for a fracture because you already have a missing part of the patella, and if you kneel down on it too much or hit it down, it might cause it to fracture completely. The other one is we see a lot of anterior knee pain when it comes to patellar tendon. Doesn't mean you're going to have it, but there is an increased risk. And the two reasons why you have that is because, one, you get piece of that bone itself. So that's already going to give you pain. And that's another one too. It's very painful because they get piece of the bone, and getting a piece of the bone, they have to drill that. So it hurts a lot. So it's usually the most painful graft out of all of them. But going back into the anterior knee pain throughout the rehab process is because a lot of people deal with some patellofemoral pain syndrome. So just increased pressure in that patellofemoral joint, the kneecap joint. The reason that is because your kneecap joint is compromised. They grab piece of that patella there. The other diagnosis that we see all the time is patellar tendinopathy, and it's very common because they get piece of the tendon. So let's say you had a tendon this big, they'll grab a piece in the middle. So now you're kind of like at 2/3. So when you go back to your increased activities, jumping, running, that patellar tendon's capacity isn't what it used to be prior to surgery. So now you have increased forces, and that might lead to some patellar tendinopathy. Another issue that we see with patellar tendon grafts is that people have some issues with extension early on. And the reason why is, one, it's painful. When it's painful, you don't want to extend your leg. And also because they grab that bony insertion there, they grab the kneecap and that patellar tendon, it makes getting that knee a little bit harder, straighter. So those are some of the main issues with the patellar tendon graft. So let's jump into the next graft, and that's the quad tendon. The quad tendon, that's the tendon that connects the quad muscles, all those big muscles, to the kneecap. So when it comes to the quad tendon graft, some of the pros are that the incision's smaller than the patellar tendon. Patellar tendon's bigger, this one's a little bit smaller. Another thing is that it's actually getting more and more research, and they've been finding that the re-tear rates are almost as low as the patellar tendon. So those are the top two when it comes to re-tear rates, which is awesome. In regards to pain, it actually has less pain than the patellar tendon graft because they don't have to grab that bony ends, which is gonna save you from that pain from the actual bone itself. When it comes to cons though, here's some of the cons with quad tendon. One, that it's not as researched as the patellar tendon. So it's getting more popular, but the research is still not all the way there as opposed to the patellar tendon, which has been the gold standard for years. The other issue that we run into is that people have some quad weakness. The reason why is they grab a piece of the quad tendon, the quad has to activate to pull the quad tendon. So when you have a piece of the tendon missing, it will inhibit the quads from really firing. So a lot of people have trouble firing early on after surgery, and that's one of the main goals that we want to get is a good quad activation after surgery. Another issue we run into is people have some quad tendinopathy down the line. So instead of patellar tendinopathy in the patellar tendon, it's in the quad tendon, and the same concept applies. You have a tendon this big, you grab a piece of the tendon so that tendon gets smaller in its capacity so the thing can accept. So when you go back to activity levels, you just gotta make sure you're progressing the right way or else you'll flare that tendon up. Another thing is same thing as a patellar tendon. People have issues getting their knee straight early on just because that tendon will be irritated. So when you try to straighten it out or try to get it as straight as you can, it'll be aggravating a little bit, and that's what people have issues when getting their knee straight when it comes to quad tendon. So the third and final graft, that's the hamstring one. So when it comes to the hamstring one, they grab part of the tendon of the hamstring. So when it comes to that is there's a couple pros and cons. So the pros is there's less pain. So there's less pain in the quad tendon and the patellar tendon. Another thing is you don't have as much quad inhibition or issues getting that knee straight early on because they grab it from the back. So it's not affecting your ability to activate your quad or get your knee straight. Those are some of the pros. The cons is that the hamstring itself is a dynamic stabilizer of the ACL. It brings the leg back. The ACL prevents that anterior translation. So you grab part of that, it's gonna affect the ability to have that as a secondary stabilizer of the ACL. Another thing is you have weakness in the hamstring. So because they get the tendon, same thing with the quad tendon, wherever you get a piece of the tendon, it's harder to activate that muscle. So for the hamstring, it's harder to activate early on, and it's really hard. People report getting their full hamstring strength after surgery. Another issue is that we've seen a higher re-tear rate than the quad tendon and the patellar tendon when it comes to hamstring. Another issue also when it comes to the hamstring is they've shown some studies that it's a little bit more lax than the quad tendon and patellar tendon. But those are the pros and cons of the hamstring itself. Less pain, however, issues with stabilization and some weakness at the end with hamstring. Overall, I'm going to give you guys like a quick breakdown. So if you're going to decide to choose an autograft, and it's because you want to get back to a high level sport, and that's the one that's normally we recommend as opposed to an allograft, but we'll talk about that in another video. But if you choose that, you have three choices. You have the patellar tendon, quad tendon, hamstring. And once again, it all depends on surgeon preferences. Whatever surgeon you decide on, they're going to tell you that, hey, I'm more comfortable with this. This is what we would recommend. Also, if you have other issues aligned, let's say you have some patellofemoral issues or some patellar tendinopathy, it might not be smart using a patellar tendon graft. So there's a lot of variables at play there. The ones that we've seen in the clinic and seen most successful, we like a lot the patellar tendon and quad tendon, not as much the hamstring. But that's just our opinion from seeing all our clients. These are the ones that we most commonly see. But if you guys have any questions regarding what graft to choose, send us a message. Glad to help you guys out as much as we can. And if you guys need help with your rehab, send us a message. We work with people online and also in Southern California area. Hopefully you guys like this video. Hit the like button, share this with friends and family, and follow our channel. We are the Basketball Doctors. Let's ball for life.